Hi everyone, my name is Helenique Arjuru, and this is for the Women of Truth Wisdom Circle, where we again today will meet another incredible woman, a global woman who is really on the front line for various issues, health-related issues relating to gynecology and obstetrics. And so I want to introduce you to this, really what I consider a cutting-edge gynecologist and obstetrician. Her name is Dr. Sabine Wünschmann, and she has training from the UK, United Kingdom, and Germany, but practices now in Greece and has recently gone online. It's a great privilege to be with her, a real honor. I myself have had personal sessions with her, and I know a few women that have also gotten interventions in her care, and I think she's a prized possession for us in the world right now, because she's one of these doctors who is really open to considering many different ways that women can heal their hormone imbalances. And she's in private practice now for 30 years, serving women internationally. Recently gone online, as I said, and also the founder of Hormone Harmony. This is an online one-on-one program which helps women in menopause and perimenopause to get really quite wise about their health and to heal naturally from the symptoms that are related to all kinds of hormone imbalances. So a really warm welcome to you, Dr. Sabine. Thank you so much for making time with us. I know you are fully busy all the time, so thank you so much for this time.
Thank you very much, Helen, for this kind introduction. It's a pleasure for me to join you on that platform, and I'm always pleased to participate in anything that can do and help for women to connect and for women to reach out. And, you know, as I've been privileged enough in my practice to deal primarily with women and young women and older women of all kind of, colors and shapes and problems. Over the 30 years of my practice, I've been really experiencing, that the classical medicine, as we've been trained in medical school, in the very, I'm very grateful for it, and it's been a very good training and everything. But I think there's so much more to it than just, making a diagnosis and covering the symptoms. So I had the pleasure to train on different aspects like homeopathy, holistic medicine, functional medicine, and, to really see that it's really about getting to know your body, yeah, and also taking the time and the space to listen to your body, because the most amazing gift that we've been given actually as humans, but especially as women, is is nature. And the way we're living today and the way society demands, our own multitasking, multifaceted way of life has basically made us lose touch with who we are and what we're actually capable of and where we're actually most comfortable. So we are trying to survive in a rather masculine world, trying to improve and impress everybody that we're better than our masculine colleagues. And in my medical experience, I've been listening to myself saying the same things over and over again. I was really coming to the conclusion that there's so much more to it than just prescribing a drug and making the patient leave the office with a prescription. So my passion and my purpose in life as a gynecologist, having been enriched with this experience that I was able to have for the last 30 years, surgically, clinically, in practice, and on the field with refugees, whatever you want to know, is that I would like to really slip out of the position as a doctor that I give diagnosis and I tell people what to do, to go into the position of the educational position, so that we sit in a room and we actually enable each other with knowledge and with understanding that is not complicated and highly sophisticated, that after a few seconds you switch off and you don't know anymore what the doctor is talking about, but actually hands-on, tools that you as a woman, anybody as a woman, can actually use to improve their health. And that's really something that I have, as a summary, retracted out of my practice. And I'm very happy with this online, method that is so powerful now, that I can reach out to so many more women than just the women that come one-on-one to me in the office. And it's been really great. And I'm very grateful to you that you actually initiate, platforms where women can hear about other women and reach out and get help, get information. It's not always help and, the inferior and the superior. It's basically connect, charge, and help each other and be connected.
Yeah, and that's why I'm so excited about having you. And I've had the vision of speaking to women exactly like you and you specifically for a while, because I see such a gap. And we've spoken about that personally. I know we really connected, and it meant a lot to me to meet a doctor like you, because I think I also told you that it was very hard in the traditional medical world to really access people who are able to make the information accessible and relatable, and to also give you the power to decide as a client and a patient. And I know here in Cyprus, we worked a lot with the NGO called Birth Forward, which really advocates ways of informing women of their rights as patients, and that they need to take responsibility for their own decision-making in whatever treatments they undergo, and how hard that really is for a lot of them, because a lot of doctors really are providing information and answers and direction to try and resolve the anxiety and frustration that people feel when they are needing to make those decisions. So I understand there's a very difficult complexity that we have to all navigate and work through. And I really appreciate, like you say, and that's why I do think you are a prize jewel in the treasure box of knowledge, information, and medical intervention, because you can provide so much experience and information that women desperately need nowadays. And we see this in our gatherings and our conferences, that there is a lot of misinformation, a lot of myths that we're still trying to break down, and a lot of challenges that I think women are facing. There's a lot of infertility in patients and women that I've seen as a psychologist over the years, a lot of illness and disease. I myself have been through some very difficult health challenges. So I firsthand have understood the value and the real powerful impact that you can have now going online. So I'm very excited about it, and I really want to support you. I wanted to give an opportunity for women to know a little bit more about you as a woman, and what you yourself might have learned from as one of your greatest challenges, or one of the challenges in your life that taught you something about life. So as a doctor, I'm sure you've had many years of experience, as you just told us, with looking at all the women's issues and challenges as well. So what would you think was a life-changing moment for you, and that you would feel comfortable to share with us, that actually pivoted you or gave you a new perception about things, enlightened you somehow more?
I mean, I'm a mother of 4 children.
Yeah.
And actually not only 4 children, actually 4 boys.
Okay.
And one of my children has very severe special needs.
Okay.
And he was nothing that could be, we could have foreseen, or anything that could have, was nothing genetic or anything. And we are in a way blessed with this boy, because of course it's a difficult path. You have your dreams, you have your vision for how how you foresee your family, how you foresee things that in life happening, and there it comes, your first child, and everything is completely different. Plus you're an obstetrician, where so-called everything should be perfect, and you are gifted with this handicapped child that has made me look so much under every corner and under every stone. And I've seen, that because this child is very special, he just doesn't fit into the norms.
Yeah.
From simple antibiotics to simple cough syrups, dosages that are just given based on the kilos, they don't make sense to him. And, on that path, being a mother and being a doctor of this boy, I really have learned for many, many years now. He's 20 years old and very good health. But of course, he's not what you would expect from a 20-year-old man. Mm-hmm. But I have learned this and cherished with my husband and with my other boys that, that being different is actually such an amazing gift, and has made us to look at the world in a different way. And I came through this child to really look the different way. I'm not saying, you know, that classical medicine is bad, by all means. I mean, it's an amazing, you know, structure. We have all the tools to deal with things. It's just not everything, you know. It's just a good base, and we could do all very well as medical professionals to look a little bit outside the box. And I think my most impression and the most changes that it has made on my character, apart from moving to Greece, being a German, you know, which was a bit of a challenge, was really having a child in a society that is kind of hypocrite and that has very different needs, and find with an enormous amount of resilience and patience and, you know, open-mindedness, different solutions that have worked for a child that was supposed to have died at the age of 6, and he's 20 now.
That's incredible.
So,
yeah.
Yes. So that's where my journey started. I mean, I would say I was always open-minded. You know, when I was in medical school, I wouldn't just follow the classical path. I would go to Africa. I would work, you know, in camps with refugees. I was always, you know, on the search for something that is outside the box. But I think being the mom of this child and being blessed enough to have another 3 children after has really made my vision and my angles completely different. I'm very grateful for it. You know, many times people say, would you do it again, or would you get an abortion? Terrible question to ask, by the way, but never mind. I would do it again and again, because it's been, you know, the biggest lesson. And I think also with diseases, you know, that, you know, coming across so many patients with problems, I do feel that people, that they do take their disease, their discomfort, their, you know, problem, whatever, you know, throws them out of their comfort zone as a challenge to look deeper, they usually do well. And I think me as a doctor, I find that, you know, encouraging looking out for other solutions that might fit you better or might fit my other patient better. I mean, we are so judgmental today, you know, everything is about, you know, we should fit the boxes, and it's just not like that. And I think, thankfully, you know, and I'm quite hopeful that medicine, even though, you know, we're reigned by the pharmaceutical industry, goes slowly towards the tailor-made solutions. You know, people are fed up with, you know, tons of antibiotics, tons of antidepressants, tons of hysterectomies. And, you know, it's actually not the colleagues that are, you know, encouraging me on my path. It's the patients. It's the women. You know, it's this beautiful community of being heard. And that is also something that we have lost. You know, you go to a doctor, he sees your file, he puts out the medication, that's it. Doesn't even take the time to see, you know, what's happening in this woman. What does she need? What is her little key that we need to find to make her feel better or make her feel more responsive to the treatment that we suggest? Why is she not responding? It might not work for her. So I think my personal path with my child and my children has really, you know, made me a very holistic doctor.
Very touching. And I mean, I think I totally agree with everything you're saying, and understand that when you are challenged yourself, and this is why that question is so pivotal for where we begin, because it's explaining that your own insights, your own experience, your own challenge, obviously, you know, opens you to new ways of looking. And that was to begin to respect difference, and to also start to expand more what you could do to really help your child beyond just the clinical or traditional medical practices. And it's worked so well that he's been able to come into this adult age. So knowing fully well that your 30 years has been also concentrating so much on many women with similar issues, maybe totally different issues, and also the whole field of gynecology and obstetrics, I feel very, very honored to ask you this question. What do you think is the biggest lie that women live with?
The biggest lie?
Yeah, the biggest deception or the myth. What do you think women are really believing about themselves throughout their lives that creates some kind of deception or illusion about life? that translates into the body, obviously, in some way that I'm sure you're picking up on and seeing. But if you really look at all these women that you've seen, do you think they are really in touch with the truth of who they are? That's what you mentioned at the beginning, that they're losing, we are all losing touch with being in tune with ourselves, with what we need, a customized approach, as opposed to, you know, what the boxes tell us to do. So how would you put that in your understanding of the wisdom that you have now about what do you think women are lying to themselves about, or have been lied to about themselves somehow? What is the illusion, the deception?
I think the biggest deception is really, you know, this maniac, you know, hunt of being perfect, or being, you know, faster, or being better, or being multitasking. You know, there's so much of this performance tick mentality that, you know, that we really lose, you know, the beauty of just being feminine.
Mm-hmm.
And I think that is one of the biggest problems, you know, that also ovaries, they don't work as well. You know, the hormones that are supposed to produce in a certain manner, they're not produced because they're suppressed by an overruling, you know, the way one should be, or the way one should look. I mean, look at all these faces, and they all look the same. They have this, you know, we don't allow ourselves gracefully. You know, we have to be perfect and firm, and, you know, looking, whatever that means, sexy. If we're 50, we're 50. So I you know, 55 or 60 or 65 can be much more beautiful than, you know, anything that is being fixed to look like 25. So I think the confidence and the rootedness in yourself, that you're okay with who you are, and that, you know, all these things that they are suggested around us with advertisements, with luxury brands, with you know, things that we should be wearing, things that we should be, you know, having, you know, it's just loading us, and it really, you know, destroys the beauty of being quiet and being oneself, and, you know, being imperfect. There's so much beauty in being imperfect.
Yeah, there you heard it, everybody out there. You heard it from Dr. Sabine. There is beauty in being perfect. And I hear in what you're saying that the body's translating those psychological, emotional thoughts and demands on the self. The body's actually translating that into the organs, the fertility, the ovaries.
Yeah.
It's so important to know. I've watched some of your videos, and I really want to encourage women to do that, because I even showed them to my mom, and we watched them together, and it was very profound to see you explaining the stress and how it impacts on a woman's sense of creativity and health and harmony. And I think that's really very powerful with what you're saying, that the body itself is going to express all those imbalances and all that demand for perfection. So looking at this world we're living in now, we've got all these women's movements that have been trying to empower women for so long, and there are more of them happening now even in the world. And I wondered what you thought about that, and if there was anything you would like to add to it. It's, I guess, also a chance for you to put your spin on it. This whole empowerment of women nowadays, what do you think about it, and what would you add to it or accent?
I mean, I think that it's a, you know, it's a rightfulness, and it's a very, very time correct movement that women, you know, are coming into their energy, and that they're empowering themselves, and that they, you know, don't allow to be suppressed anymore or worth less than, you know, the male power. I'm very excited, and I'm very happy about it. I would like this not to go overboard, though. I would like, you know, our power that we have, you know, because at the end of the day, women are the ones that they really shape the universe. I mean, it's maybe not in critical political positions like Putin and Trump and Erdogan and you name them. But I think, you know, behind the scenes, a lot of women, they have a lot of influence on decisions. Maybe not in person, But so I think it's a wonderful thing that women are becoming more visible, and that they're also empowered to do things. But I would like us to be also not forgetting the male counterpart. As you know, I don't want us to go overboard, you know, all about women, and then, you know, we become too masculine in that as well. So I would like us to also remember that, you know, femininity is a very beautiful thing. It doesn't mean weakness. It doesn't mean, you know, doesn't mean uneducation. But, you know, to have a man open the door for you doesn't mean that you are, you know, that you're weak, if you know what I mean. So I think, you know, in the empowerment that is happening, which I'm super happy with, and I'm part of it, and I'm really pushing for it, I would also like to stay feminine, and I would like to invite women to really nurture their feminine sides, and to also listen to their bodies, depending where they're in their cycle, you know, to do things according to their menstrual cycle, not to push themselves overboard from the enthusiasm now to be empowered, you know what I mean? Absolutely. So I think there is a risk there that we might go overboard, which probably we won't, but I think it's good to create awareness also that, you know, we do stay within our femininity and being so powerful. I mean, it's not for no reason that Dalai Lama says, you know, the Western world will be saved by Western women. Yeah. So, you know, but let's do it gracefully and feminine.
Yeah, and that's also important for us to stay healthy, right? And to keep our balance with our body, that we don't override all that masculine energy, like you say. Just because I have you here, and I know it's hard to have time with you, what would you like to say to women out there as maybe one really important aspect that they could start to focus a little bit more on? You've mentioned really being proud and healthy and confident about their femininity and their own personal body, listening to that. And of all the cases that you see, what is for you the most troubling symptoms that you think women need to just be aware of or be careful about?
I think there's a huge wave of lack of sexuality. Right. So women really, you know, experience a lot of decreased libido. So, you know, they don't really have the energy to have sexual encounters with their partners, because they're so exhausted, and they, you know, they're so multitasking, and they're having so many multiple, you know, things going on parallel, that the last thing that they can actually focus on is to be sexually active. And I think, you know, the way the infertility goes up, the way the need for fertility treatments is really increasing, you know, by the year. So I think, you know, in the older days, you know, you would prepare all day, and, you know, have the makeup and have the baths and have the oils and whatever applied. And that it was not because they were specifically vain, but because they would prepare, you know, for the act of making love. And I think we are accommodating too little time for that, that you need to actually calm down and, you know, be also a little bit receptive for the signals of the other one. Don't be the multitasking bullying that just wants to tick the box to get the little sex thing done. So I think it's a, you know, it's a I don't know if you agree, but that's what I see to a great degree. And I think it's a shame, because, you know, a lot of the dopamine and the oxytocin and all the hormones that actually keep us young, they really get increased when you have pleasurable sexual intercourse. So, you know, let's put a little hold on too many tasks at the same time, and, you know, prioritize, delegate. There's nothing wrong with explaining to somebody and say, you do this now, you do that now. I'm going to just sit down for half an hour and have a lovely bath and put nice oils on me. I mean, you know what I mean. Just to take a step back and just remember who you are, why you are with your partner, for what reason you chose them, and look at him, you know, with a loving look, and you know, remember what attracted you in the first place, because the decreasing sexuality is really shocking. It's very easy to have sex, very easy, you know, around the corner you can have sex in any toilet, but it's been becoming very rare to make love and to actually feel fulfilled. And I think it's a big source of power for us women.
Absolutely. I think this sensuality that we crave from all these other things outside there, which is turning sometimes a little bit superficial, you know, like makeup, painting, looking good. It's all a little bit ironic and paradoxical if we are not really tapping into our own natural sensuality and nurturing that and receiving our own grace and beauty from our own sense of being, and how attractive that is, and attracting and being nourished through that. And I also can see how hard it gets. You know, it's hard in life to play all the roles, especially when you have kids. And it's so nice to hear you accent it so that women can really be more mindful and careful to become like Cleopatra's in the bath for hours, which they'll never get to do, but at least to start.
Maybe not for hours, I'm not saying that, but you know, we are beautiful. We're beautiful creatures with our curves, with our imperfections. We don't need to go and, you know, iron out everything and Botox out everything. Just, you know, stand up for who you are and love yourself, because only when you do that, you can actually love somebody else. And, you know, I think, you know, women in these contexts as we are, that's why these movements of yours are so important, you know, because it creates awareness and it creates, you know, the togetherness of really making an effort to connect with women, that you actually slow down. We shouldn't be proud of being multitasking tanks.
Superhero woman. No, in fact, I have a very strong motivation from a lady called Dr. Pat Allen from America. She's very strong on how to help what she calls alpha females learn to do the things they hate doing, because we criticize a lot of that. I think a lot of women that came out of this generation of now starting to work, compete with men, have power, da, da, da. And there's a lot of overriding masculinity in us, and we become sometimes very toxic in that, and very unattractive, very competitive, very demanding, and it's really not good for our health and or for our relationships. So I think it's
and for our hormones.
And that's why I'm speaking to you, because that's what we want to add in. It's really not good for our hormones either. So women need to find those ways to slow down, like you say. And tell us a little bit about what you're passionate about now. I know you have recently gone online and you've got some videos that we can watch. Can you tell us a little bit about that, and anything else that you're really focused on or that you're excited to introduce to us, that we can learn more about you and what you do through?
I mean, basically, I've created, you know, all sorts of topics that I find myself repeating myself. So with all these patients, the thousands of patients that I'm seeing every year. So I felt, let me put this online so that people can get the information. So, you know, there are a lot of pillars that we actually need to work on, okay, so that our hormones are really working well. So I feel very passionate about the gut. I feel very passionate about the liver, very passionate about, you know, mindfulness and stress management and on multi-layer level. And then, you know, if you do manage to, you know, to get a balance in that, you will be surprised to see how much better your hormones work and how much less work I have to do actually with my hormones. But so this whole program is basically to educate women to be aware of what they're doing and how it doesn't influence your, you know, your hormones. Because a lot of women, you know, they end up with antidepressants, they end up with orthopedic problems, they go from one specialty to the other, and they actually don't understand that, you know, the whole underlying cause might be the hormonal imbalance. So my course is basically addressing with them, you know, the necessity and the tips and the tools, what they can do to improve, not for me to do it for them, what they can do. This is very important. I want to encourage them, to enable them, to give them the tools that they can do it. And then, you know, it's like if you register in a gym, you might decide to go or you might not decide to go. But if you register with me, you actually not only register with a gym, but you actually enroll with a personal coach, that you do go through the steps that it needed to get into hormone harmony. And when you're in hormone harmony, you become yourself. You're going to be a Cleopatra bathing lady on a Saturday evening before you go out, and you might enjoy your
love that.
your
beautiful.
Yeah, so that's what it is about. So I'm very excited and I'm very passionate about it because I think it's the secret to many things, and it's a secret to encouraging women to be more confident about themselves, to hopefully distract them from all these superficial solutions that they're around, and really go to the core of what is really needed to be in harmony with yourself and also be in hormone harmony.
Fantastic.
So that's what.
So that's actually all available.
So there's a. It is a. You can do a one-on-one harmony with me, which is kind of more personal, and you can also do an online course, which is more general but also very detailed. So there's something for everybody. There's also something for people that they just want to see the videos and get the you know the emails and the information articles and all the things that I provide you free of charge. So it's something for everybody taste. Somebody that need to be taken by the hand, somebody that just want to listen to videos, others that want you know, they want to be more encouraged by me. So it's a educational, life-shaping, life-changing experience to enroll, I hope.
Beautiful. And
What's the feedback was?
Sorry, again?
The feedback has been overwhelming. I mean, I'm surprised myself. On the other hand, I'm not surprised because I know that a lot of women, they feel not heard, and that they feel they cannot address, you know, the issues with their gynecologist. So if they listen to somebody that just speaks out about things that, you know, they are embarrassed about, it's helpful. So it's been very, very rewarding. I'm actually extremely moved how beautiful it's going.
Yeah, I'm totally convinced that it's in right time and it's the exact feedback that's needed, because there's been, as I say, in my experience, such a gap for this information. So I'm very glad it's out there now. Just to be clear, it's for anybody that has any questions about their gynecological or hormone health. Can be women in menopause, can be women trying to conceive, women after conceiving, giving birth, really, because we all have somewhere on the scale.
Yeah, women with fibroids, women with endometriosis, women with infertility. I do Facebook Lives every week. We do a Q&A, you know, I do a lot of things where you can actually reach me. So it doesn't need to be exclusive one-on-one. And you know, so you can also learn from the questions of others. So, you know, it's a beautiful platform where we actually meet, and, you know, whoever has a question asks, and you know, it's very educational for everybody, and it's becoming more and more people every month.
Fantastic. I'm going to jump on very soon too. I want to learn as much as I can about it. I think it's vital. And I want to give you this last...
DrSabine.com.
DrSabine.com. We're going to put it all on this video box link, and I would like to actually keep it listed for longer time than a lot of the videos that we have been speaking to experts about, because I think this one is very important information for all women to just get really well educated in. If you have kids, it's also really important to start teaching daughters differently. I think it's time. Three words from you, Dr. Before you go away, give us 3 powerful words that capture your wisdom, whatever they may be. They can be connected, like you own it, or you have power, or they can be 3 separate words that capture some of what you think is really important to leave us with.
I think one important word would be education. You know, always look out to educate yourself, and, you know, make informed choices so that you know what you're talking about. Don't just get, you know, bypassed by some sort of superficial information. Go and try to get deeper. The second word I would say is be passionate. You know, if you have something that you really interested, go for it. If it doesn't tick the boxes of society, or it doesn't tick the boxes of your friends, or it doesn't tick the boxes, it doesn't matter. If you really, you know, if you're really passionate about it, go for it. And the third thing is to give yourself a little bit of me time. I think once a day you should do for half an hour not exactly Cleopatra bathing, but you should do something that is good for you. You know? Be good to yourself. Educate, be passionate, and be good to yourself.
Beautiful pearls of wisdom from you, Dr. Sabine Wünschmann. Thank you so much for your time. Everybody you follow.
My pleasure. It's been great.
Yeah.
Inspiring with you. Please keep up the good work. You're wonderful and you're a role model for everybody else. And I'm very happy to join you.
Thank you so much. Maybe we talk again sometime in the future. And to anybody watching, you can go and get these free videos just by signing up. You also have access to Dr. Sabine and her knowledge, expertise freely. And you can also work with her in a much more easy, accessible way online, if that's your wish. And thank you so much for watching. Thank you for your time again. Bye-bye.